How are we doing for quorum?
We are still waiting on at least one other commissioner to join. It looks like we have 4 commissioners on. So we're waiting on Commissioner Breedy, Commissioner Bokowski, Commissioner Sparks. Sparks is here. Sparks is on.
I am here. Good morning.
Chair, I think we have a quorum.
Let's go ahead and make sure, Pam. Why don't you just go ahead and do a quick roll call to make sure we have quorum?
Commissioner Antwerp.
Here.
Commissioner Breedy. Commissioner Bokowski.
Present.
Morgan.
Here.
Commissioner Sparks.
Present.
Commissioner Green.
Here.
Commissioner Womack.
Present.
Commissioner Wooden. Chair Jones.
Here.
So we have 7 commissioners present, 2 are absent.
Perfect, and that's quorum. So I want to welcome everyone to the Finance and Physical Resources Committee meeting. Today is Tuesday, January 19th at 8:30 a.m. Wayman, would you read the notice regarding electronic participation, please?
Sure. Pursuant to MCL or State Statute 15.263A, the Finance and Fiscal Resources Committee of the Kent County Board of Commissioners will conduct this meeting today via electronic communications to protect the public health. Any member of the public wishing to listen to the proceedings or provide public comment may do so by using the following internet connection, phone numbers, and passcodes as listed on the screen. And if you have an agenda, it's listed on the agenda. Closed captioning is available via an internet connection. Those wishing to provide input or ask questions in advance of the meeting regarding business to come before the committee may submit the input or questions to public comment at kentcountymi.gov. Anyone disrupting the meeting by using offensive language or any actions may be removed from the meeting.
Thank you, Wayman. With that, I will go to agenda item 1, which is public comment. So I will open public comment. And we're opening public comment for the Finance and Physical Resources Committee this morning.
Chair, I do not see any messages in the public comment email inbox, and there are no hands raised in the chat.
Anything now, Pam?
I just checked again and there are no messages.
Okay, we will close public comment and that will bring us to item number 2 on our which is our consent agenda. Is there a motion to approve the consent agenda?
Moved by Morgan.
Support by Womack.
Okay, we have moved and supported. Any items have to be pulled? Not hearing from any of the commissioners. Pam, would you please call the roll to pass the consent agenda?
Commissioner Antwerp,
Yes.
Commissioner Breedy,
Yes.
Commissioner Bokowski,
Yes.
Commissioner Morgan,
Yes.
Commissioner Sparks,
Yes.
Commissioner Green,
Yes.
Commissioner Womack,
Yes.
Commissioner Wooden, Chair Jones.
Yes.
That motion passes.
Thank you. That brings us to item 3 from the Administrator's Office. And Health Department, which is a contract with the solutions to provide project management and planning on a mental health crisis system. Wayman, could you please review the action request?
Sure. This is a request to the Board of Commissioners to accept contributions and approve the contract with TBD Solutions to provide project management and planning for a successful implementation of the mental health crisis system. A broad community effort has been underway for several years to create a better system to manage mental health crises. A crisis center task force collected feedback on the concept and analyzed financing needs. The task force presented their findings to the Kent County Population Health Force Consortium, and the list includes several, including Spectrum Health, Forest View Hospital, Hope Network, Mercy Health, St. Mary's, Metro Health, University of Michigan Health, Pine Rest Christian Mental Health, and Mary Free Bed Rehabilitation Hospital. I'd like to also point out, before I go to the next bullet, the Mental Health Crisis Center Task Force included Chair Bolter, Vice Chair Stan Steck, Chris Becker of the Prosecutor's Office, and several others, including Matthew Denzett from our team. And of course, now we're into like our third year of this effort. The consortium agreed to engage in an independent consultant to provide recommendations for enhancing the behavioral health crisis system in Kent County for children and adults, including the creation of a secure crisis center. Tri-West was selected to develop recommendations for implementation of the crisis system, and they completed their work in December of 2020. Tri-West identified several major activities and next steps that would need to be addressed by the project manager or project administrator through 2021. Kent County was asked to facilitate the request for proposal process to identify a project administrator. And at the conclusion of that process, the consortium selected TB Solutions, LLC. TB Solutions team will address three top priorities: development of a crisis center, enhance mobile crisis services, and improve psychiatric inpatient access. The fee for TB Solutions services is not to exceed $255,000. It is estimated that $85,000 will come from the private sources and up to $170,000 will come from the general fund supported budget in the health fund. Might also point out we've received two additional commitments from agencies. We received one from this past week from I think it was Hope Network, and we're also received one from the Mary Free Bed. I think they're listed on here. So we're expecting to hear back at some other time from Forest View Hospital, but the numbers continue to grow. We expect the county's contribution to be lesser than the amount that's identified here today.
Okay, is there a motion to approve?
Moved by Breeby.
Support Polkowski.
Okay, we have moved and supported, and we will now take questions, comments, and discussion. Commissioner Polkowski.
Thank you, Chair. Yeah, Wayman, bunch of questions. I mean, first and foremost, absolutely agree with the overarching goal and vision of this, at least what can be ferreted out of this memo, and, putting this system together to address, mental health crisis in a better manner. That being said, just wanting to ask a couple questions related to, I thought we spent like $400,000 on the development of a mental health crisis center. And now it seems to be a priority of another project.
Yes.
And how is this all fitting together? And then, of course, do we have projections in future years how many dollars may be coming or be asked from the general fund to support this?
The initial funding was about 300. You're right. It was between 350 and 400. I believe that number is about 350. $350,000. That was for the purposes of assessing the recommendation from the Crisis Center Task Force, which we talked about earlier. The initial request was on the table to build something like Common Ground out of Oakland County. And the community said, well, let's take a look at that because maybe that isn't really what we need. And so we pulled in Tri-West to review that and look at other models across the country, not just Oakland County's model. And that took quite a long time, pulling in all of the key players into the conversation. The hospitals were not as involved on the first go around with the Mental Health Crisis Center Task Force. It broadened the reach of those who are involved. And it just took longer to come up with what we understood to be the best laid plan. At this point, what Tri-West has determined is that there's multiple components of this process that need to be included in order to stand up a crisis center. It's more of a crisis system other than a center, which would include a center potentially downtown, in the downtown area, in the Hartside area potentially, not somewhere out county. And then, of course, another location for more secure beds that perhaps could go somewhere near our correctional facility. So those ideas came back along with the fact that there needed to be a way to coordinate these various services and then to also pair them up with how do you pay for these on a long-term basis. That was the work of Tri-West, and they looked at multiple models across the country, did a lot of interviewing with people in the community, various stakeholders that were involved. That was the work that Tri-West completed. They now have completed that work and come back with a number of recommendations and next steps that would move us to implement the system. We need a project administrator, a manager of sort. If you go back to the history of the Sports Commission, I would liken it to that, in that there was a subcommittee formed by the board. It created a subcommittee to look at it. Eventually, it created the Sports Commission Executive Committee and then the broader advisory committee. That took 2 or 3 years to do all of that. And then now we have, of course, the Sports Commission, which has been underway for the past 12 years or so. We had to pull in other experts to build out the framework for the Sports Commission. We brought in a consultant, a national consultant, 2 of them actually. And we created what now is the Sports Commission, which has been very successful. Same concept, larger scale, but now is the time to put more meat on the bones and determine how would we in fact do what we've determined to be the best laid plan. That's the role of the project administrator. So that's where that cost comes in. We're expecting that plan to be fully developed with budgets, with facility planning, with all of the different attributes needed to make this plan work. So now we get into the nitty gritty of making it work. And then once that plan is netted out, there would be a request to the community to either lift up a smaller, a center perhaps in the downtown area, maybe somewhere outside of the area, maybe. There are costs that are going to be associated with that, then who's going to pay? Spectrum Health, Mary Free Bed, Pine Rest, Hope Network, Forest View Hospital, Network 180 are all a part of those discussions. They will have a plan for cost, the budget that will be needed if in fact there's a need to stand up a building. Some say that potentially there isn't a need to build another building for this purpose. Some say there is a need. So that's what we're trying to lock down now. What size are we looking at? What are the attributes? That's what the project manager is going to do.
All right, thanks for that excellent recap. So this is a budgeted amount in the health fund for 2021?
Yes, there are dollars that are associated with this project in the middle. There's a Jeff, could you help me where that's located, or Marvin, if you're on the line, please?
Yeah, good morning. So there was a budget of 200,000 total in the health department fund. This is obviously a little bit more than 200. So we're going to move money from other budgeted items in the healthcare fund to cover this.
Okay, and then last question, who's the, I understand that Network 180 is a independent authority. That being said, I know over the past few years, you, Wayman, and at least Commissioner Steck have felt that Network 180 is still a pretty big part of the county since you've done huge amounts of work, with its budget. And I mean, I'll just leave it at that. So that being said, who on the county side of the table, of this many-sided table, is like in charge? Is it you and your office, Wayman? Is it Network 180? Is it the health department? Like, who's the point person for Kent County as Kent County?
Well, at this point, it's me and of course, Jenny James from this office. Those are the two primary principals here. Prior to me becoming the administrator, I was the point person, of course. Matthews and Zetton, he was involved as well. But now it's myself and it's Jenny James. In addition to that, we have the health department, Adam London, who has a big stake in this and his team. So you have the health department, you have Network 180, you're right, they're an authority, but we go appoint their board. We still have a responsibility for their success to some degree. The state of Michigan does too. We've never completely divorced ourselves of them, and it was a smart thing to do with the current circumstances. If we had divorced ourselves from them, we would have a lot more problems, I think. But in addition to that, of course, we have other team members within the administrator's office that will support it. Jeff Dode, of course, our legal counsel. It's a broad network of support from the county to ensure that at the end of the day, we have a plan that works. It doesn't rob us of the very few revenues that we have in the general fund to make this go. The reason that they pulled the county in, myself, I was contacted by the Network 180 board chair and staff. At the time it was Stan Steck, the chair of that board. He's still the chair, I believe. And to ask if we could intervene to pull together those key players in the hospital community. So I pulled in Mike Jananoa, who some of you might know, business leader. He also serves on one of those boards, actually serves on several of those boards at one point, served on the Mary Free Bed board, I think. He may have served on Mercy Health's board, but really understood what was going on out there and had a lot of influence. We pulled him in. He and I chaired the consortium and made sure that we stayed on point. And they've stayed galvanized for the last 2 years. They are committed to supporting this by evidence of the fact that they are all joined in to support this next phase. And I can't speak to some of the new developments that are occurring, but I can tell you that there's more to come in terms of their commitment around this project. So they're very committed to this.
All right. Well, thank you, Wayman, and thank you, Chair, for indulging my questions.
Absolutely. Commissioner Womack?
Yes, I have a question. Now that TBD Solutions will provide some of this management and planning for this mental health crisis, I've looked at the consortium, and I was wondering if they will be reaching out to the Grand Rapids African American Health Institute or Grand Rapids Professional Nurses, if they will be including anybody that's connected with the minority health issues in Grand Rapids. Not to say that our partners aren't, because I'm aware of all the great work of those that are involved, but have they reached out to any of the health organizations that are doing some of the grassroots things in the Hispanic or African American community to be
Yes,
a part
sir,
of
they
this?
will continue to do this, but I wanted to also share with you, there was a work group, a consensus work group that included Cherry Health, which included Tasha Robinson. I think that's her last name. I can't remember, but she, of course, is very connected to the grassroots community and the work that they do. as well as you mentioned, the Institute for Nursing. There was an individual in the early stages of this conversation, I believe, that was from that group when we first met up a couple of years ago over at the Grand Valley State University. Tasha Blackman, thank you, Monica. Thank you, Tasha Blackman, not Robinson. But she's been very involved with this work as well, and we will continue to make sure that that happens.
And if there are any groups like Gora High that may be interested, is there still room for participation and input from those other organizations?
Yes, and I don't have the exact list of those that were asked for input, but I would imagine that they were reached out to. If they weren't, we'll make sure that that happens. Commissioner, you're making a very good point. Because the population that we're serving are mostly those who are disenfranchised members of the community who lack the ability often to be able to access and benefit from this care. So absolutely, we will make sure of that.
Okay, thank you very much, Administrator Britt.
Okay, Commissioner Morgan.
Thank you, Madam Chair. Good morning, everybody. Just to kind of get my head around the funding of this, Wayman, what you're talking about is it a build it and they will come kind of approach to this? I'm wondering, yeah, go ahead. Sorry.
Yes, it is more of, I wish we had it already built because we are still dealing with a number of people in our emergency rooms that shouldn't be in our emergency rooms, a number of people in our correctional facilities shouldn't be in our correctional facility, and a lot of people that don't even get care. It's one of those situations. It's something that we should have had in place years ago. And so, yes, I believe that once this is done, we will have more need than what we suspect. There probably is more out there that we're not even dealing with.
Okay. So once we build this platform, what I'm trying to get to is you think there'll be more organizations coming to the table with funding?
Yes.
As we move along, that's what I wanted.
Yes. Sandy Frost Parrish from Canary Consulting did an initial evaluation of this project when it was deemed to be a crisis-centered concept. And there were several philanthropic organizations, including the Fry Foundation, Steelcase, Community Foundation, others that they've reached out to. And those folks see the same issues as they deal with problems that surface through grant requests that they receive. So there is definitely that. And I'm sure once this is put on the table, here's what it's going to cost, like we've done with other projects, like we did with the dental clinic in Michigan, dental clinics that we set up the partnership there. They came to our help and supported that project. We would see the same thing happening because this gets right at the core of what a lot of these philanthropic community members believe we need to have in place. It's just that it hasn't been put together in a comprehensive enough way for them to employ their resources to support it. I did meet with David Fry about a year and a half ago. He was very supportive of this. We interviewed him and others to get their input. I believe they stand at the wait for us to come back with, here's what it's going to cost, here's what it's going to take. We hope that we can land this without having to draw much support from the county other than via the Network 180 and the support that they can provide through their funding from the state of Michigan and from the feds. When we started this, we received additional funding from the feds to help with some of the evaluation. The second leg of the work that Tri-West did was funded by Network 180. The federal government, state of Michigan also sees this as an important enough project that we should see funding supporting this work going forward.
Okay, good enough for me. My last question, Wayman, is can you remind me once again who was on the original committee? It was the prosecutor and Stan.
Yes, I can run it down. I have it right here for you, Commissioner. Chris Becker from the prosecutor's office, Mandy Bolter, who was at the time the vice chair of the board, Mark Harrell, she was county board vice chair, yep. Mark Harrell, public safety at East Grand Rapids, Maria Kowalski from the behavior health, priority health, Greg Hoffman from the Lakeshore Regional Entity, Larry Oberst from the Grand Rapids Public Schools, Daniel Roper from St. Mary's. We had Beverly Ricecamp from Network 180. We had Amanda Schoolmeister from Metro U of M Hospital. Matthew Van Zett, I mentioned. Becca Vasquez Publice, Director of Urban Core Collective, and Sergeant John Witkowski from the Grand Rapids Police Department.
Good enough for me. Thank you.
Okay, there's currently no other hands. Wayman, I have a few. I would like to start with, how does this blend with what currently exists, which is the Pine Rest Urgent Care?
Okay, this will provide a more centrally located opportunity. Pine Rest also does not have the ability to take on the type of clients that typically fall out in that community and are not able to service them at a rate that would be compatible to their overall cost. So we're looking for something that can blend both those who can pay, those who can't pay, and then bring them in a more quicker, easier location for servicing versus out on 68th Street, out in, very far. It's probably 20 minutes away, half hour away to get out there. We need a place that we can locate people when they're in emergency within 5 to 15 minutes of the time that the crisis occurred, so that the police officers, the sheriff, the Wyoming police, the Grand Rapids police, all have a place that they can help deal with a situation that's in crisis. That location does not help that.
Correct. So I just wanted to emphasize that is the niche need for this, where it isn't necessarily someone that is a suicidal risk or needs some additional urgent care help along those lines. This is more for our police needs, where there is a mental health issue and they have a place to go other than the jail. That was my understanding when this started. Is that still the right understanding?
That is it. That's a big part of it right there. Yes, ma'am. And then there are some who are not a risk, but because they are in such a need of help, they're not a danger to anyone, but simply they do not have the capacity at the time to be able to take themselves to get care. And we need to respond to those people, whether they're a risk to others or not. We just need to be able to deal with them a lot quicker and better, so that they don't graduate into this higher level of need of care where they become suicidal.
And then who is going to own a brick and mortar building if one is built?
It could go one or two ways. It could be a private entity, a 501c3. It could be something like a mental health authority like the Network 180. It could be a hospital who, if they decide to move down this lane, several different ways to do that.
Is it possible the county will own it?
No. We are simply being the facilitator, the coordinator, the puller together, the convener, if you will, to make sure that somebody does it and they get tagged to perform the work.
Okay, can you give me a little more detail on the enhanced mobile crisis services that's referred to?
Let's see. Adam London, are you on the line, or Bill Ward? Could you chime in? I've been talking a lot. I don't know if either one of those two are on the line. They're in the middle of it.
Wayman, I'm on.
Bill Ward.
Go ahead, Bill.
All right, thanks. So to your question, Commissioner, there are two types of mobile crisis that currently are being used in Kent County. One is the children's mobile crisis, which have been going for a number of years by Network 180, and they are responding based on requests from either the schools or if we get a crisis call that comes into the access center. We eventually want to expand that out to make sure that law enforcement or first responders have access to that team as well, which can be used, if there's a first responder contact and it's determined that it is a mental health crisis as it relates to children and adolescents, we want to be able to allow for first responders then to contact us to go in and do a diversion. So then that first responder can move on and answer the need of the community that's not a mental health based. As I think I briefed this honorable body before, Network 180 was really successful in May of last year, and we were awarded what's called a Certified Community Behavioral Health Center. And as part of it, in that grant, we are now able to add a adult mobile crisis, which will do the same thing as the children and adolescents. That team was just launched probably about 3 or 4 months ago. So we're still just getting kind of that off the ground. The challenge is, as why this program is so important, that is just not enough money to fund the appropriate number of teams that we need for the county. I see that the county probably needs somewhere between 8 to 10 teams at any given time that can be dispatched out for this kind of crisis intervention, so that individual doesn't have to go to your point, Commissioner Jones, to either the ER or booked into the jail. So this is just another, hopefully, and I think that with the help of TBD Solutions and the rest of the consortium that Commissioner Britt, or that Administrator Britt talked about, we can bring those other payers to the table so we can fully fund that program.
And Chair Jones, this was a best practice that was identified by Tri-West across the nation, that in many cases, these crises happen at very inconvenient times. And having mobile crisis response teams that could address them where they're at is a big step forward.
Okay, I think Commissioner Womack had his hand up again.
Yes, thank you, Chair Jones. I had to adjust my mute button, but I just really want to thank our staff and everyone we're working on with this. Thank Mr. Ward, Administrator Britt, Mr. London, and Jeff Dodd for all being so involved in this, so they were able to answer our questions today. Just looking at the mobile units being a groundbreaking, innovative technology that I'm sure will advance the psychological health services in our communities and our county is going to be so welcome in the community, because a lot of time when people are facing mental health issues, when law enforcement gets involved, gets involved with a person that might be a danger to themselves, others, law enforcement, people in the community that are witnessing it may not know about these mental issues that people are going through. So to have mobile units that can come out and respond, it's just so groundbreaking. I'm proud that this is being put together, as well as some of the other mental health issues. And just want to give a big pat on the back for all the people that are involved. And it's definitely something that I support. And I believe that the finances that are being put into this are going to save money in a whole lot of different ways once we get into this. Thank you very much, Chair Jones.
Thank you, Commissioner.
Hey, Pam, can we please call the roll to pass agenda item number 3?
Sure. Commissioner Antor,
Yes.
Commissioner Breve. Commissioner Breve.
Yeah.
Commissioner Bukowski,
Yes.
Commissioner Morgan,
Yes.
Commissioner Sparks,
Yes.
Commissioner Green,
Yes.
Commissioner Womack,
Yes.
Commissioner Wooden, Chair Jones.
Yes.
That motion passes.
Thank you. That brings us to item number 4 from the Department of Public Works. Wayman, could you please cover the action request?
I can find my document, I sure will. Got crossed up there. This is a request to the board to accept $49,100 in grant funds from the Michigan Department of Environmental, Great Lakes and Energy, Eagle Materials Management Division designated for Kent County Department of Public Works to increase residential recovery and the value of plastic at the Kent County Recycling Education Center. DPW has been notified by the Michigan Department of Environmental, Great Lakes and Energy that it will receive an Eagle Recycling Market Development Grant in the amount of $49,100. This grant will allow DPW to lead the state in identifying and tracking processing technology that creates new markets, stimulates demand, and supports businesses to commercialize technology that improve the quality, quantity, and the demand for recycled non-deposit and non-container glass in Michigan. This research will directly inform future opportunities at the Sustainable Business Park. Additionally, the Kent County DPW and project partners will provide an $18,700 match, which is included in the total of the recycling market development grant budget. Corporate Council has reviewed and approved all documents to form.
Thank you. Is there a motion to approve?
Moved by Brady.
Support by Womack.
Okay, moved and supported, and we'll take questions, comments, and discussion. Okay, we are not seeing any hands, so Pam, would you please call the roll to pass agenda item number 4?
Sure. Commissioner Antor,
Yes.
Brady,
Yes.
Commissioner Bukowski,
Yes.
Commissioner Morgan,
Yes.
Commissioner Sparks,
Yes.
Commissioner Green,
Yes.
Commissioner Womack,
Yes.
Commissioner Wooden, Chair Jones.
Yes.
That motion passes.
Thank you. That brings us to item number 5 on our agenda from Kent County Community Action. Wayman, would you please cover the action request?
Yeah, this is a request to recommend to the Board of Commissioners to appropriate $51,300 from program income for the home program and the Community Development Block Grant Program to the Community Development Federal Project Fund. Community Action has received unexpected program income to the Community Development Federal Project Fund totaling $51,300 and requests an additional appropriation of that amount. Home funds in the amount of $2,800 were captured from a home sale and were used to assist with tenant-based rental assistance expenses for program period 2019 through 20. Home funds in the amount of $18,200 were received as income from home sales and were used to assist with expenses for program period 2021. CDBG funds in the amount of $30,300 were received from rehab loan payments. These funds will be reprogrammed for similar projects for program period 2020 through 2021.
Thank you, Wayman. Is there a motion to approve?
Motion to approve. Motion to move. Womack.
Support
Supported by
Bukowski.
Sparks.
All right, moved and supported. We'll take questions, comments, and discussion.
Is Susan Shavantes available? My fault.
It's okay,
I
Commissioner
believe
Womack.
so. Susan, are you there?
I am here, yes.
Did you have questions, Commissioner Womack?
Yeah, just one simple question. Want to give her opportunity to tell us a little more about the programs and how these funds will affect those programs and how those programs affect the community. Just something short.
Right, well, with the CDBG funds, a lien is put on the house once we do the moderate rehab program. And then it's a forgivable lien, 0% interest. And if people live in their home for 20 years, it's forgiven, the whole amount. But if they cash out or they sell their house early, then they pay us back with a proportion based on a denominator of 240 months. So let's say they've done 10 years of their lien and it's 120 months, then they would owe us 50% of what we put into their house. And we do it that way so that people just don't fix up their house and then flip them over and make money off of them. We're doing it to provide affordable, stable housing. And then for the home dollars, those home projects are usually done in conjunction with an affordable housing developer such as ICCF or Link Up. And those homes are rehabbed to a substantial amount, either over 75,000 or they're built from the ground up. And then people receive a subsidized mortgage to live in those homes. And so when they vacate the homes or sell the homes, then a portion of what we put into the project is paid back to us. So anything that we get from these funds goes back into the programs to provide additional affordable housing to residents of Kent County.
Thank you very much. Thank you.
Thank you.
Okay, anyone else? Not seeing any other hands. Pam, would you please call the roll to pass agenda item number 5?
Sure. Commissioner Antor,
Yes.
Commissioner Breve,
Yes.
Commissioner Volkowski,
Yes.
Commissioner Morgan,
Yes.
Commissioner Sparks,
Yes.
Commissioner Green,
Yes.
Commissioner Womack,
Yes.
Commissioner Wooden, Chair Jones.
Yes.
That motion passes.
That brings us to item number 6, which is miscellaneous. I'll start with a warm welcome to Commissioner Ben Green for joining the Finance and Fiscal Resources Committee. Welcome. Glad to have you in the mix, and know that it's always nice to have new experiences and different viewpoints added to the committee. And I want to see if anyone else has any commissioner miscellaneous this morning. Commissioner Womack.
Yes, just want to welcome Ben Green, Commissioner Green aboard, and also want to say Happy New Year's to you, Chair Jones, and thank you for all the extra work you've been putting in being our chair of this committee, and let you know you're doing a great job.
Oh, thank you, Commissioner Womack. Commissioner Green.
Thank you, Chair Jones. Just wanted to say thank you for you and Commissioner Womack's kind words. I'm thrilled to be here. Looking forward to working with you all.
And maybe we can hold out for 2021 for an in-person meeting, which is always my preference. As much as is efficient as this is, in person is certainly my first choice. Any other commissioner miscellaneous this morning? So we don't have any others. We will move to adjournment, right? And no others? No others. We will move to adjournment, and our next meeting is Tuesday, February 2nd, 2021 at 8:30 a.m. Thank you.
So.
That might be extra.